Good afternoon, everyone, and welcome to today's Guide to Medicare and Golden Retirement event, proudly presented by Priority Health. Navigating the complexities of Medicare plans can be a daunting task, but fear not, we have assembled a panel of expert speakers with one singular mission: to simplify and demystify this process. They will guide you through the intricacies of Medicare, ensuring that by the end of today's event, you'll have the knowledge and the confidence to choose the right plan that fits your needs. So whether you're a seasoned Medicare beneficiary or someone just starting to explore your options, our experts are equipped to break down the information into manageable and understandable pieces. And we know many of you have burning questions about Medicare, and we want to hear them. So do not hesitate to jump into the chat or the Q&A box here on Zoom. If you do that, though, make sure you pick all attendees and panelists. Otherwise, I will be the only one seeing the questions. And if that happens, I will make sure that people get it correctly. Our team of experts ready to respond to those questions, whether it's through the direct chat that applies or to the Q&A segment on the virtual stage. So rest assured, all your questions and the corresponding answers will be compiled at the end of all of this and sent to you via email at the beginning of next week. And this comprehensive document will include not only the Q&A, but also other valuable resources provided by all of our experts. Now, before we jump into the program, we want to express our immense gratitude to our sponsors, without whom we cannot do events like this. A big thanks to Priority Health, HAP, and Blue Cross Blue Shield of Michigan. For more information about these fantastic partners, check the chat or visit our event website. Now, let's take a moment to hear a brief message from our valued partner, Priority Health.
My priority? Get moving. Doctor's orders. And since my Medicare plan with Priority Health lets me try a bunch of workouts, I knew I'd eventually find the perfect fit.
Priority Health. Health coverage that fits your priorities.
All right, let's take a look at what's in store for the next hour and a half. First up, Lauren Glover from Priority Health will kick things off with a comprehensive overview of the various Medicare options. Get ready to gain a solid understanding of that landscape. Following that, our experts will dive into a detailed discussion on the crucial topic of how to choose the right plan for your needs. This segment promises valuable insights and answers to your burning questions. Then we round out the program with a vital conversation on what to consider when choosing a drug plan. And this segment will equip you with the knowledge needed to make informed decisions about your drug coverage. Now, guiding us through today's event is my dear friend and colleague, the illustrious and one of my favorite human beings on planet Earth, John Heiner. John, how are you, my friend?
Eric Hulkran, it's great to be back. We did this last year. It was one of the most fun evenings that I had, way more fun than I expected. And I enjoyed it so much that prior to tonight's event, I went and watched the video, which is on YouTube, to bone up on some of those answers again, but also just to admire how young we still look. A year later, and these topics are increasingly relevant to me, as I spoke last year, and also to our readers. I have to say, I wrote a column 2 weeks ago promoting this event. I heard lots of great feedback, and I want to give a shout out to those who told me they would join tonight, and thanking MLive for hosting this event and bringing the experts on. So, glad that you're all here. There's going to be a ton of information, but as I said, this is going to be recorded. They'll be available afterwards. You can always go back to it. And, you can always, like me and Eric, come back next year if you are of that relevant age. So I'm looking forward to tonight's event. We've already got some great questions lined up. And Eric, without further ado, I'm going to let you take it away.
Thank you, my friend. Always a pleasure to have you along for the ride. Our first session of the day begins now. And for this, I would like to welcome Lauren Glover to the stage. Lauren will walk us through the different Medicare plan options. She'll do a side-by-side comparison of traditional versus Advantage plan and explain what the individual parts cover. Lauren is the Medicare Territory Manager for individual Medicare Advantage and Medicare supplement plans at Priority Health. Her territory covers the central portion of West Michigan, and she has been in the insurance industry for over 11 years, including 4 with Priority Health. It is my absolute honor and privilege to welcome Lauren to the virtual stage. Lauren, how are you this evening or afternoon? What are we calling this?
Well.
Evening,
Yeah.
whatever that is?
late afternoon, early evening. Glad to be here. Thanks for the introduction.
The floor is yours, my friend.
All right, very good. Thank you so much for having me. I'm glad to be here today. As Eric mentioned, my name is Lauren Glover. I'm proud to be representing Priority Health Medicare today. So we thought it might be helpful to just get an overview of Original Medicare, your plan options once you have Parts A and B, so that the questions that come later make a little bit more sense. So it all starts back in 1965, when Congress created Medicare, really to help mature Americans, regardless of their income or their medical history, have coverage in their later years. So it covers people who are 65 years of age and older and people with some disabilities. Original Medicare is made up of two parts, Medicare Part A and Medicare Part B coverage, and that is managed by the federal government. So when we talk about Part A, that's inclusive of hospital insurance. So it's usually free and it covers most of your inpatient care at a hospital, care at a skilled nursing facility after a hospital stay, and some home health care and hospice care. Part B, on the other hand, is medical or doctor insurance, so anything outside of the hospital. And for this coverage, you're going to pay an annual deductible plus a monthly premium to the federal government. You might pay more for Part B if you are a higher income earner. And in return for that premium, you have coverage for things like doctor visits, medical services, and supplies. So if you got into an accident and hurt your knee, go to the doctor, that's covered by Part B. And then if you need a cane for a while, that would be covered under durable medical equipment. So that too falls under the Part B umbrella. So you can choose either or both of these coverages. Since Medicare eligibility begins at age 65, it's a good idea to start thinking about and making those coverage decisions prior to that 65th birthday. You do have a 7-month enrollment period to sign up for Original Medicare. So you can sign up 3 months prior to your 65th birthday, the month of your 65th birthday, and the 3 months following your 65th birthday. If you already receive Social Security benefits, you'll be enrolled in Original Medicare automatically and get that red, white, and blue card that you see on the screen in the mail 3 months before your 65th birthday. If you do not already receive Social Security benefits, you'll need to enroll in Part A and Part B if you want. So even if you're still working when you turn 65, you should definitely be enrolling in Medicare Part A. Medicare is big. It covers 47 million older adults, but it's not one size fits all. So you have lots of choices when it comes to your Medicare coverage. How you combine those options depends on your medical needs, your lifestyle, your budget, all of those things. So Original Medicare is a good option because there's no network of doctors. You can see any Medicare participating doctor with that coverage, but the problem is that it doesn't cover everything. So if that doesn't sound good for you, there are other options to help fill in the gaps of that coverage. If you need to enroll in Medicare Parts A or B, you can visit your local Social Security office. You can call the Social Security Administration, or you can sign up online at ssa.gov. So let's get to Parts C and D. I know there's a lot of numbers being thrown or letters being thrown around. Medicare is a little bit complex. So hopefully after our conversation today, you feel a little bit clearer on that. Once you have Medicare Parts A and B, again, that's covered by the federal government, then you have some options to consider. So that's where Medicare Parts C, D, and Medigap come in. Private companies like Priority Health manage Medicare Advantage plans, or Part C, Medicare prescription drug plans, Part D, and supplemental plans known as Medigap. So let's talk about that Part C. It's optional Medicare Advantage, and it combines that hospital coverage, so Part A, and that medical coverage, Part B. Some Medicare Advantage plans also include Medicare Part D prescription drug coverage, so MAPD, Medicare Advantage prescription drug. What's great about Medicare Advantage plans is you have predictable co-payments. So you're not surprised by how much you have to pay when you see your doctor. Some plans have monthly premiums and a network of doctors and hospitals that participate in that plan. Medicare Advantage is a popular solution for seniors because it also includes coverage for things like dental, vision, hearing, gym memberships, things that are not covered by original Medicare. So if you want the simplicity of a single plan, a single card to show when you seek services, then Medicare Advantage could be a great plan for you. To join a Medicare Advantage prescription drug or MAPD plan, you have to be enrolled in both Parts A and B of Medicare. You'll continue to pay that Part B premium to the government, which can be deducted from your Social Security check. You'll also pay a separate monthly premium to your insurance company for your Medicare Advantage plans, though I will say most plans being sold today are likely a $0 premium plan. So with Medicare Advantage, again, you only share one card when seeking services, and you don't need to use that red, white, and blue card that we talked about earlier. So lots of extra benefits. A big supplemental benefit that we might talk about during the panel discussion is like an over-the-counter benefit. So money that your Medicare Advantage plan provides to purchase things near the pharmacy. So your ibuprofen or your heating pad, things like that. So lots of options there. As the commercial we watched a little bit earlier showed, you've got some coverage for gym memberships. So if you are familiar with MVP, you can go to MVP to work out or take some of the online workout classes as well. So lots of extra benefits that come with Medicare Advantage, which makes it a really popular option. You can also have Medicare Advantage with Medicaid or your group health plan, but you cannot have both Medigap and Medicare Advantage. On the first side of the left side of the screen, you see secondary insurance like Medigap. Medigap fills in the coverage that original Medicare does not provide. So when you only have Parts A and B or original Medicare, that only covers 80% of your medical expenses. So if you would like to bridge the gap, hence Medigap, you can purchase a Medigap policy, and that fills in the 20% that original Medicare does not cover. The difference between Medigap and Medicare Advantage is that often Medigap premiums are much lower or much higher, excuse me. So you're paying all up front versus Medicare Advantage is a little bit more pay as you go with those predictable co-payments we talked about. If you go the Medigap route in partnership with your original Medicare Parts A and B, you can add a standalone prescription drug plan, which we'll talk more about Part D later in the conversation, but that Part D plan covers your prescription drugs, as we mentioned. So a few different options to go. Again, it's not one size fits all. So it's important to kind of know if you like to travel, what options make it easier for you to travel, and so on.
Thank you, Lauren. That was awesome. You will obviously be back in the Q&A. And if that was a lot for you and you're like, oh, I don't know all of the stuff that Lauren just said, but I need all of it. All of the information that she just showed is available on the resource page, and the link to the page is in the chat, and we'll also send it to you by email after today's event. Okay, let's dive a little bit deeper and discuss how to choose the right plan for all your needs and what coverage you should have. For that conversation, I want to introduce our three experts and bring back John Heiner. Up first, Margaret Anderson, Senior Vice President and Chief Sales and Marketing Officer at HAP. Margaret leads a dynamic team that is changing the way insurance products are designed and delivered to serve HAP's members and communities. Joining Margaret is Judy Worth. She's the sales manager at Blue Cross Blue Shield. Judy is part of Blue Cross Blue Shield for over 40 years and has served in multiple roles throughout her long-standing career. In her current role, she's responsible for leading the sales consultants in field agent sales for Medicare products. And finally, my dear friend, Gary Boveroff. Gary is a sales agent at Priority Health and has owned his agency for the past 15 years. and is an expert in Medicare benefits. Welcome to the three of you, and let's welcome back in John Heiner, and the floor is for all of you.
Hello, good to have you all here. And Gary, good to see you again. I know you were with us last year, and I appreciate you coming back. I'm going to kick it off by directing the first question to Margaret. Margaret, what are some things to consider before changing plans?
John, thanks so much for having me. It's an exciting time for Medicare beneficiaries here in the state of Michigan and throughout the United States. Some of the things that I would really look at are some things that people don't necessarily consider. One is your doctor in network. Are the drugs that you are on currently covered by the plan you are thinking about moving to? What does the customer service and star rating, which is so important for Medicare Advantage plans, what does that look like? So you can ensure that when you have needs and you need to access your physician, your provider rather, and your health plan, that you have the ability to have a health plan that's going to coordinate care for you. So very important to look at all of those different variables. But I would definitely say making sure your doctor is in network and making sure that your drugs are covered are very important. And having trusted agents out there that can help guide you is important, as well as just being able to call the health plan. And you've always got resources where we can provide information to you for that as well.
Excellent. Thank you. Judy, does Medicare offer rewards for healthy lifestyle choices?
Not Medicare itself, but the health plan could offer healthy rewards.
Excellent. And Gary, do married couples have to share the same Medicare plan?
They do not. In fact, the Medicare plans are individuals. So you would want to make sure that the plan that you have fits your needs for your doctors and your medications, and that can be drastically different from husband to wife.
Okay, excellent. Back to you, Judy. If a person has health insurance through a spouse's workplace, can they keep that coverage and add Medicare?
That's a great question. So the first thing I'd want to do is confirm with the group that they'll allow the Medicare eligible individual to stay in the group plan. And then if they do, and the group is over 20, the spouse can defer Medicare Part B and not have to pay that monthly premium while they're on the group plan. When they're ready to retire, when the spouse is ready to retire, then they would want to apply for Medicare Part B at least 60 to 90 days before they're going to retire. So they make sure they have it in place when they go on to an individual plan. And then if the group is less than 20 employees, then the individual is going to be required to take Medicare A and B, and then Medicare would be the primary payer.
Okay, great. Thank you. Margaret, if a person already has Medicare, do they have to renew it during the enrollment period?
During the annual enrollment period, they do not have to renew it. If they want to make a plan change, the time for them to make that plan change and they can actively shop is during the annual enrollment period, which is from October 15th through December 7th. There's also something called the open enrollment period, and that runs from January 1st through March 31st. And that's where any Medicare Advantage enrollee can decide that they want to make a plan change. They have one chance to do it during that time period. But that's just in case maybe they pick something wrong during the annual enrollment period. They're not getting the service from the plan that they expected. It allows people to make that change to say, you know what, I thought this was a good plan for me, but I probably need something different.
Great, good to know. I want to stop for a second and just note for our attendees today that people are sending questions in, they're coming in, our staff is sorting them and getting them queued up for it. We do have some prepared questions here to make sure we cover the topics that people want to know the most about and that had come in advance. But when we get to the end of those questions, we will go to the questions in the chat that have not been answered so far. So thank you, Gary. This person writes, I am turning 65 in 2023. Do I have to sign up for Medicare during the current enrollment period?
No, that is for people making plan changes, as Margaret just said. You would have 3 months prior to your birth month and 3 months after your birth month to sign up. That would be your initial enrollment period. So that is different from the annual enrollment period or the open enrollment period, which is for everyone who's presently on Medicare.
Very good. Margaret, I'm going to send this one to you. What prep work should someone who is not yet enrolled in Medicare do to help make picking a plan easier when that time comes?
Well, I think a couple of things. I think a lot of people don't realize that they need to start paying into their Part B premium and that needs to happen maybe prior to their time when they retire. So understanding that Part B premium component is very important. The second thing I think is really just doing your research. I think, there are 69 Medicare Advantage plans that are offered in Southeast Michigan, and I believe the number is right around 52 in West Michigan. So when you think about the plethora of choices and it starts becoming a sea of sameness, there's not much differentiation between benefits. Really looking at things like star rating, looking at things online around what are the maybe accolades or things that the plans have won, because that's going to really differentiate. So for example, at HAP, we are US World and News World Report #1 plan in Michigan. That's not us saying, hey, we're great. That's a third party saying, hey, this is a good plan that you probably need to take a look at if you're a resident in Michigan. So I think it's, looking at the full picture. I think the anecdotal comments at times, not everybody's going to be happy. It's like any industry. We're a service industry. And so sometimes there's things that get out there that people might have an anecdotal comment, but it's really looking at the guts of the plan. How long have they been in business for? How dedicated are they to their community? I think that's another really important component. These are your dollars. I mean, whether or not you're paying a premium, you're paying your Part B premium, the dollars that are spent on your care in Michigan, be paid by the government or whomever, really can stay in Michigan. I mean, and I'm blessed to be on a panel today with two people from Michigan-based health plans. And I think that makes a big difference. It's great to know that, I'm calling somebody that knows how to say Novi and not Navi. So, I mean, I think it's really important to think about the little intricacies and what's going to be important to you, and that these people really know the communities that you're in.
This question came in while you were speaking, and I think it's relevant to toss it in now. And it's open, anyone can answer it, but they're saying I'm being inundated with mail and pamphlets, et cetera, urging to join Advantage plans. Then I read there are issues with Advantage plans, choices of doctors, referral permissions, and if you want to go back to regular Medicare, you can be refused by any supplemental plan. So please talk about the disadvantages of Advantage plans, and what you would tell these people who are seeing all this coming at them.
Yeah, so I'm lucky that I've worked in almost all 50 states in the country, and every state's different. I like to say healthcare is like politics; it's all local, right? So, thinking about choosing a plan that's headquartered in Michigan for me, if and for my parents and my family and friends, is important. I mean, the community. Typically, we have very similar networks, so that you can have choice. You can make sure that your doctors are in network. You get access to the care that you need. Most of, your call center agents, your claims are being processed here, provider relations is boots on the ground. So that's really important too. So, I mean, I just, and I'm not a native Michigander. I've been here for 5 years. So I'm starting to claim it as my state and enjoy it and don't plan anything different. However, I would say that, we really need to think about how important it is to look at the local impact of health plans in the state of Michigan. Yes, you get inundated, and I will tell you, I mean, people tell me all the time, Medicare really rates plans based on quality of care and on service. Those are the two biggest things that they rate your plans on. And I will tell you, it is not an easy thing to get a 4-star rating. And the 3 folks that you're talking to today here in Michigan, we all have 4-star or better plans. So that's a testament, right, to what we're doing. Star ratings do matter. And there are several plans that you're getting inundated with in your mailbox that are not even 3-star plans. And so it's based on a 5-star system. Anything less than 3 stars, plans start getting sanctioned. Those are things you want to stay away from. So, I mean, do your homework. It takes 2 seconds to look it up on CMS Plan Finder, and you can see what those star ratings look like. So if you do feel compelled, hey, this pamphlet's telling me something that I'm going to have a benefit that's really meaningful to me, do your homework and look up what's behind that offering. Because what tends to happen throughout the Medicare Advantage product life cycle is that health plans change their benefits from year to year, and some do, I'll call it a whipsaw effect, pretty significantly, where you'll have really great benefits one year, and then the next year they'll lose a star rating and they'll cut them back pretty significantly. So it's important for consumers to be educated. I know people don't get excited about star ratings, which makes my clinical team crazy, but it is something that at least is a litmus test for you to say, is this a plan I should engage with or think about shopping with?
Well, what you're saying is going to segue right into the next question. I think it dovetails really nicely. But before I ask that question, it's going to be for Gary. Welcome to Michigan. 5 years. I think probation's over. But do you have a Verner's in your medicine cabinet? Because if
Yes.
you do, you've become a Michigander. So
Yes, sir. Yes, sir.
okay, then you're good.
Yep.
Gary, how can I find an independent Medicare agent and be sure that that person is looking out for my best interests?
Yeah, and I think that's important to have a good agent. I would never give out my information over the phone. And if they're calling you and all that kind of stuff, it's usually a sign of desperation. But talk to your friends, talk to your family, talk to someone that you trust. And I've always found that we get most of our business from referrals from family and friends. And then interview them, sit down with them. And are they in business 12 months a year, or are they only working during open enrollment? There are some agents that all they do is work during open enrollment, and then you can never get a hold of them. They should be helping you with customer service. They should have a good relationship with all the carriers. You know, I personally represent all 3 of the carriers that are on the panel today. And you want to have an agent that has a good relationship with them, so that if I had to get a hold of Judy, I've got her cell phone number. Now, I try not to abuse that. Occasionally, I might text her late at night, but I try not to. But if your agent has a good relationship with multiple carriers, and that's, I think, an important thing too, is they should be a broker. They shouldn't be a one-trick pony where they only have one company. I had a couple in here today. They had their financial planner set them up with a Medicare plan that wasn't in their best interest because that was the only game he had.
Mm-hmm.
So you can't build a house with just a hammer, and you shouldn't have an agent that only has one company. So find somebody that your neighbors trust, your friends trust, and somebody who represents multiple companies so that he can get you the plan that best suits your needs.
Thank you. Judy, is it possible to receive both Medicare and Medicaid?
Yes, we have beneficiaries that have both Medicare and Medicaid. They like the extra added benefits with a Medicare Advantage plan, whether it be the dental, vision, hearing option, the gym memberships. So yes, they can.
Okay. And Margaret, attendee asked, should I choose an HMO or a PPO?
Depends on your needs. So I think that you have to look at the benefits that you have. If you're somebody that wants to travel extensively throughout the United States, if you're somebody that is agnostic to, like, I don't really care if Henry Ford Health is in my network, I just want choice and being able to go see any Medicare, any provider that accepts Medicare is something that's important to you. That's good. I would say we are getting better as an industry in terms of quality on the PPO side. But currently, typically most plans have a higher quality rating for an HMO plan, just because the networks are closer and more tightly aligned. But again, it depends on the needs. And again, looking at a lot of times the maximum out-of-pocket cost for a PPO plan may be higher. Some of the specialist copays might be higher on a PPO plan because with choice comes cost. So it really depends on the needs of the individual. So again, really doing your homework. And I couldn't agree with Gary more. Having somebody that represents more than one carrier that can actually take you through what is going to be the best health plan for you is a huge asset.
Mm-hmm. I'm going to stick with you for a second because we just had a question come in and say, where do you find the star ratings on the current plan they may have?
I mean, you can go to the health plan website. CMS has a tool called Plan Finder. So you can go to Plan Finder and it's there. And I think I have Kyle on the line with me. Might phone a friend exactly what the website address is. If you could put that in the chat, Kyle, that'd be awesome. But you can go right onto CMS Plan Finder and it will list all the different star ratings. It'll actually rank the plans by where CMS has an algorithm for the best plan. So for example, HAP right now, our PPO product is the #1 product in Kent County. So, there you go. Thanks, Kyle, Medicare.gov. So, I think just looking at the Plan Finder piece now, and I will say this with a caveat too, even though the ranking might be in like the top 10, it still might not have your doctor in the plan. So you kind of have to go that next layer deep, but being able, you can see the star ratings, see all the high level information. And then, again, partnering with an agent. If you prefer to do it on your own, that's fine. I will say that, we are so fortunate to have such a great distribution channel in our agents and there might overlap to many of our competitors that, it's worth it. It doesn't cost people anything to have an agent. The health plans pay that cost. So it's a resource that you can really leverage to help you make that choice. It's incredibly confusing. So if you can get anyone to help you cut through the noise, that can be good.
Great. Judy, what are supplemental benefits and why should I care?
Supplemental benefits, Medicare offers, standard benefits, but then oftentimes your Medicare Advantage plans, well, they do. They offer the supplemental benefits such as the dental, vision, hearing, an over-the-counter benefit, silver sneakers. So if those are benefits that you would utilize and they're built into the plan at no additional cost to you, then, I mean, it's a great option for you. That's what you use.
Okay, I want to tell our panelists that we've had several people in the questions in the chat that would like something a little more specific on what disadvantages may come with an Advantage plan versus regular Medicare. What might you sacrifice, or what's different that would be a disadvantage in some situations?
Well, I guess I would start out by saying if you're in an HMO plan, it has a defined network. The PPOs are normally a more generous network. Some of depending on the plan, like the HMO, some services may need prior auth, but that could be as well with a PPO, but not as much. Margaret, you want to add to that?
Yeah, I mean, I don't think there's a huge disadvantage, and I think anyone who's on a fee-for-service Medicare plan is doing themselves a disadvantage. Either getting on a Medicare supplement product or a Medicare Advantage product, I think, is critical. It took me 5 years because my dad's, knows everything in the world when it comes to business, and so I've been in this business for 25 years, and it took me 5 years to convince him to get off of fee-for-service Medicare. And now that I have, he's like, "Why didn't you yell at me louder? And why didn't you get me, into this plan sooner?" So I think it's about I think there's definitely a mindset that if I'm paying a $0 premium, then I'm really not getting the quality care that I need. And that's just not true. So I think there's so much that CMS and the federal government have done to create a very quality program with robust benefits for people, making sure that they can get access to quality care. That is, I mean, we want the difference between kind of a fee-for-service approach versus a Medicare Advantage approach. Us as health plans and Medicare Advantage, we want our members to use their benefits. So there's this mindset that, hey, the health plan is going to deny coverage, going to deny care. We want you to use your plan. People who use their benefits, the way the benefits are constructed, actually have better outcomes, have higher quality of life. They have definitely coordinated care in a different way. And so, and also having the pharmacy component combined, I think, is really important. We can see right away when we get a pharmacy claim in, oh, wow, all of a sudden, Margaret Anderson's, she's getting insulin. We got to get her enrolled in our diabetes care management program and help her navigate that journey. So there's just a whole lot more. You've got a full team behind you when you're in a Medicare Advantage product. Very different in fee-for-service. You're kind of left to whatever care model the individual physician practices have, and it varies within health systems, within health practices when you're in a fee-for-service product.
Thank you.
It makes a big difference too as to what their health situation is. I've had many people that were in poor health at 65, and we would do a Medicare supplement for a couple of years. They get cancer behind them, and then maybe they switch over to Medicare Advantage at a later date. I've had a couple clients come in here in their 80s, and they were spending $6,500 on their Medicare supplement plan, and we switched them to a Medicare Advantage plan that had a max out of pocket of $4,200. So there really is no downside at that point, for sure. So it depends on everybody's situation.
And this next question kind of piggybacks on that. Maybe you sort of answered it, but if you need to disenroll from a supplement plan, what's the best way to do it so you're not inadvertently enrolled in a supplement plan and a Medicare Advantage plan?
Yeah, the time to do that would be during the annual enrollment period, which is now October 15 to December 7. By enrolling in a Medicare Advantage plan, it would automatically disenroll you from your prescription plan. So that part's easy. But disenrolling from your Medicare supplement, you'd have to actively do that by either calling the company or sending them a letter saying that you want to end your plan the end of the calendar year. Because when you make an enrollment now in Medicare Advantage, it doesn't go into effect until January 1. So if you end your supplement 12/31, the Advantage starts on January 1. There's no gap. It's seamless. It goes right from one to the next.
Okay. Question: if all of these plans are regulated by the government and provide the same coverage by law, why would anyone feel the need to change providers after their initial enrollment?
Well, on the
Same
Medicare
for-
Advantage,
yeah,
there's
sorry.
go ahead, Margaret.
No, you go ahead, Gary.
I was just going to say that the basic services are required by the federal government, but a lot of the supplemental coverages and the copays can be different and vary from plan to plan. And I think probably the biggest reason for somebody maybe to make a change from one year to the next is medications. Formularies can vary from one carrier to another. So that's where I've seen, a husband on one plan, a wife on a different plan, just because of the medications they're taking. So the bare basics are covered, but there are some of the perks that vary from plan to plan.
Okay. Some Medicare Advantage plans have an item stating Part B give back. What is this give back?
So a Part B give back it's a reduction in your Social Security that you have to pay. So, and different plans may have different amounts of Part B give backs that are available to you.
Okay. Is there some kind of schedule on that or chart or it's graduated based on how much Social Security you get? What are the main factors, the key factors of that?
Well, the health plan is going to determine when they develop their Part B give back, they're going to determine how much they're going to be offering you built into the plan.
Okay.
So it could vary by plan.
Yeah, absolutely. And I would just caution people when you look at those plans, because not all are the same. A lot of them will say, hey, we're going to give you $160 back in your Social Security check, which when you're on a fixed income, that's meaningful, right?
Mhm.
But sometimes what one doesn't realize is that you now all of a sudden are going to have a medical and a pharmacy deductible that you're going to have to hit. So
Okay.
even if you're getting that $160 a month back in your Part B check, you're going to have $1,000 that you're going to have to hit before any of your coverage cuts in. So just be really careful about looking at those plans to make sure that you're not at the end of the day going to put yourself in a disadvantage from an out-of-pocket perspective.
Okay. If you travel a lot, will Medicare Advantage cover me no matter what state I'm in?
Yes.
Most cases, yes.
Yes.
Yeah. Yeah.
Okay, very good. And I think we touched on this, like, depending on what agency you're with, that there may not be fees involved in getting assistance. But do some of the independent agents charge fees, and what are those typical? What should they expect?
They do not charge any fees. In fact, they're prohibited from doing so.
Oh, okay, excellent, very good. Next question that's come in: what is the maximum out of pocket on Medigap G versus the Advantage plan?
So the Medicare supplement. So when you have a Medicare supplement, Medicare is primary and the Medicare supplement is secondary. So it doesn't have an out-of-pocket max like a Medicare Advantage does.
Okay. If one has medical conditions like heart problems or stroke, would a supplemental plan be better than Advantage?
Well, I think that's a clinical and personal opinion, but I would say that from a coordination of care perspective, Medicare Advantage is probably going to be your better option due to the fact that there's several programs that are built into what Medicare Advantage can offer in terms of coordination of care for the biggest two that we get in Southeast Michigan in particular are hypertension and diabetes. So folks with those kind of conditions typically do better from a clinical outcomes perspective in a Medicare Advantage product.
Okay. How do I keep my original Medicare plan and add dental coverage? Can I add dental coverage at any time?
Dental and vision, hearing, those benefits can be a separate standalone plan. If you do a standalone, you'd pay a premium for it. If you get it combined in your Medicare Advantage, typically there's no premium for it at all.
Okay, very good. How does Advantage coverage work while traveling outside the U.S.?
I think it depends on the carrier. So, I mean, let Judy speak to maybe her thoughts on it. I mean, for us, we have worldwide coverage 24/7 through Assist America at HAP. But, I think it varies by carrier in terms of anything that's urgent and emergent will always be covered. So.
Yeah, it would just be the network that they use. Blue Cross Blue Shield has a PPO network that we use. But again, everybody urgent and emergent care, you're always covered.
Travel away.
What is a good option for a couple in excellent health with no prescription meds?
I would make sure they get prescription coverage just so that they don't have a penalty later on. Even if you're not taking medication, either a Part D plan or a Medicare Advantage that includes prescription coverage is still important. But if they're in good health and they take no medications, there's a lot of zero premium Medicare Advantage plans that would take very good care of them.
Very good. And some of the questions are still coming in, so I'm going to continue. And this is a general one, and feel free, it's a toss up, but what are the main basic changes coming to Medicare this year?
Coming to Medicare in general?
Yeah. Any major changes that people need to be aware of?
I mean, I don't, Judy, feel free to chime in, but I mean, not many in terms of what Medicare is seeing overarching. There's always the push and pull. The star ratings have become much tougher, the whole star rating process. So CMS is clawing back. I think it's a $45 billion payment that they're looking to cut down to about $30 billion over the course of the next 2 years. So they're going to make it harder. So the higher star rating you have, the more quality bonus payment dollars you get. And as health plans typically that we have in our state, more regional plans or local plans, we reinvest those dollars back into benefits. So that's why the state has 61% Medicare Advantage penetration. We're the second highest in the country for Medicare Advantage penetration. So that we have more Medicare Advantage folks than most states do. And part of that is because we invest those dollars back into benefits and have very competitive benefits. The one thing that has changed, and you all might have noticed it, I certainly do because I'm acute to it, is there has been a lot of changes made to CMS marketing guidelines. So you're not seeing Joe Namath on 24/7. They've also eliminated the any company, although I just saw it, I was on a flight down here to Florida today, and I just saw an ad for Medicare Advisors Inc. to call. So I took a screenshot. I'll send it to my CMS rep in the morning. But they've eliminated the ability for any third-party agencies to use the word Medicare in their title. So I'll share a story. My mom, who's a retired CPA, lives in Buffalo, New York. She's like, you're not going to believe it. I enrolled with a plan and I'm going to get $1,000 extra a year in X, Y, and Z. And I'm like, wait, what did you do? And it turned out she didn't realize that she had disenrolled from her existing plan and enrolled unknowingly via telephone. To Gary's point, I never give any information over the phone. And she lost the benefits that she had before. Now, we were able to get her back in through the open enrollment period, but they can be very sneaky in terms of the tactics. So again, it's really important that you don't give out your Social Security number. Medicare is never going to call you. They're just, does the IRS call you? No, they send you nasty letters. But so they're not going to call you. So anyone who's marketing with the term Medicare in their name is against any kind of guidelines. So that's really what's cracking down. And I think, like, in terms of changes to the Medicare Advantage product as a whole, I happened to be last week in DC at the Senate Finance Committee. They're looking at ways to put more dollars and more benefits into the beneficiary's pocket. And how do they look at that in totality, and how do they police it without taking benefits away from the beneficiaries? So that's, I think, really where they're focused on right now.
One common theme in our comments and questions is, how can I find someone to trust? And I know because this can be overwhelming and complicated, but you've all touched on this, and Gary, you did very well talking about how to find somebody, what to look for, and red flags and so forth. But that's a common theme in a lot of our questions here.
Yeah, and there is one change that is beneficial for people this year, and that is that catastrophic drug coverage is zero this year. In past years, once you went into the donut hole or a coverage gap, then you paid 5% of the cost of your medications. And now when you get into catastrophic coverage, it's going to be zero on all meds. So all covered meds will be at zero on the catastrophic side.
Yep. And just a programming note, we have a whole section of this program tonight on how to choose a drug plan. So we'll be coming back to that. Why is my husband paying a different premium than when we file jointly? Then he pays a different premium than I do when we file jointly.
In terms of Part B?
That's the whole question. So maybe we'll come back to that. Maybe they can prime question. Why does Medicare not require approvals, but why do Advantage plans require approvals?
So I can give you a perfect example. So I think it's all about managing quality care, and it's about access to care. And like I said, I joke, it's the bottom three, right? Health insurance, tobacco, and oil. And so how do we kind of get out of that persona? We had a person who actually sent a woman who was one of our plans, and she was denied a CT scan. And so she actually sent a letter to our CEO, and he actually reads them, and I get them on a regular basis. Hey, follow up with this person. But the reason hers was denied was because she had a contraindication to iodine, which is the contrast that they use when they give a CT scan. So she was denied a CT scan, but approved for an MRI. So I think that a lot of it is less about denying access to care. As I said before, we want people to use their benefits. The more you do preventive medicine wise, the more you do to make sure you're getting your screenings, the better your health outcomes are going to be. And that's what we as health plans are held accountable to. And so it's less about, no, we're going to deny this drug, or we're going to deny this. It's more about what's the right thing for you right now. Is a knee replacement the right thing, or could you do PRP stem cell therapy? Is that something that's going to be better for you in the short term and the long term? So I think it's more about thinking about how to manage care better and for better outcomes, as opposed to saying, no, you can't have this test or drug.
Mm-hmm.
And an agent should be your advocate on something like that too. If there's something that the insurance company missed, or the doctor didn't pre-authorization, or missed something through that, certainly your agent should be your advocate and help coordinate all that with your carrier and your docs.
All right, thank you. Question: I have found the Medicare Plan Finder overwhelming in that most carriers have lots of different options. What's the most effective way of assessing these plans?
I mean, I'm going to give a plug to our agent distribution channel. I think if you can work with an independent agent and go through, what your needs are, what's important for you. We're very fortunate. And Gary, I'm not sure what the best resources for people to find an agent that's in their community. Certainly they can go on to any of our websites. HAP.org is going to have the ability to connect you with an agent. And obviously people have our agents, and I think all the carriers in Michigan, their agents go through certification. We go through auditing and everything else in between. So, I think we're really fortunate to have a great distribution channel here, external channel in Michigan. But I would really highly recommend getting that help. Again, it's not going to cost you anything out of pocket. If anything, it's going to help you make an unintended mistake. So I think if you can leverage that agent channel, or even, just working with the health plan, we do a lot online with chatting with folks and what have you. We've got a Medicare quiz that people can take, and it'll kind of point them in the direction of what's the best plan for me. But I think that one-on-one approach with individual agents, in my opinion, is probably the strongest.
Mm-hmm.
Yeah, our company spent several $1 million on software that will sort through all the plans based on your doctors, your preferences, your hospitals, and medications. And it'll pull up what your total cost would be for a good year, a bad year, and everything in between. So use those kinds of resources. It's free.
Fantastic. Do Advantage plans have unlimited out-of-pocket costs for out-of-network? Is there a limit on out-of-network costs?
The Advantage plans, they can have an in and out of network cost share, but I've not ever seen one that's unlimited. No, there is a maximum.
Okay. If you have cancer, is it best stay with original Medicare and a supplement?
Again, I think it depends on the individual needs, right? I mean, if you were to talk to, and HAP is a wholly owned subsidiary of Henry Ford Health, and if you were to talk to any of the majority of our docs, and if you were to talk to cancer specifically, they would advocate for their patients to be in a Medicare Advantage plan to help them better manage their out-of-pocket costs. Again, we've got that ability to coordinate care differently. And so I think that for sure they would advocate, and we on a daily basis get docs. They're like, hey, can you help my patient? They're struggling financially. Is there something we can do differently for them? And typically we can get them in a pretty good $0 premium Medicare Advantage plan and do two things: limit their out-of-pocket costs and help coordinate their care in a more qualitative way.
Mm-hmm. Should you be worried about quarterly dollars given to you for out-of-pocket costs, such as over-the-counter medications?
It's an added perk, but I don't know that would make my decision. In most cases, decisions are made by the cost of medications. If you've got a lot of your medications are generic and you're getting it for zero cost, and you're getting $60 a quarter versus a plan that could give you $100 a quarter, but then your medications are several $100s a month, that wouldn't make sense. So you've got to factor a lot of different things in to look at it. I mean, the OTC is nice, and it's become kind of a calling card for a lot of people. They come in and say, I want that plan that gives me $100 a quarter. Well, I know exactly which plan they're talking about. But having said that, you got to look at the whole totality of your care.
All right, and I have only one question left, and if anybody has more questions to put in, I'd urge you to do it. We have a few minutes left in this segment. But this is a really fundamental one. Who needs to enroll or re-enroll?
If you're in a plan and you like your plan, it will automatically re-enroll for you. You don't have to do a thing. It's not a bad idea every 2 or 3 years just to review to make sure in case there's any changes. You certainly can review it every year. But if you like your plan, it'll roll over. There's not a thing you need to do.
Excellent. Does Medicare and or Medicare Advantage cover experimental medicine like clinical trials for cancer treatment when the cancer doesn't respond to traditional approaches?
I mean, typically, no, we wouldn't cover experimental drugs. There are trials that if people want to enroll, we'll certainly help them get connected, but typically that's not, unless Judy, you've got a different opinion.
No, I agree with you. Yeah.
But traditional Medicare wouldn't pay for that either, so it wouldn't matter.
Okay. Is my spouse covered under my Medicare plan? Does this change with Medicare Advantage plans?
Each individual is enrolled in a Medicare plan, and then they can choose what option works best for them. But it wouldn't be two people on one plan, like in a group plan.
Okay, thank you.
Mm-hmm.
Those are the questions I have right now. If I would like to bring our host Eric back on, we can keep the program moving. As he said earlier, keep the questions coming, and we'll answer the ones we can in the chat as well.
Awesome. Thank you, friends, for this expert round. We're going to shift gear. Well, not really shift gears. We're going to keep going here. Let's talk about drug plans and what you should consider when choosing a drug plan. How do you know if your drugs are covered and what's new for 2024? To give us answers to these and many more questions, I welcome back Lauren Glover from Priority Health. Lauren, how are you?
Hi there, doing well.
Awesome.
Thanks, panel, for that awesome discussion. So we kind of touched a little bit on that Part D prescription drug coverage. I know there's a lot of questions when it comes to pharmacy and how that all works. So let's talk about that. So do I need to sign up for Part D coverage if I'm not on any meds, or can I add Part D coverage later when I need prescriptions? So the short answer is no, you don't have to sign up. It is technically optional coverage. But if you delay enrolling, so let's say you stay on original Medicare and you don't purchase a prescription drug plan, it's not going to bode well for you if you ever need to get on prescription drug coverage for help with your prescription drugs later on. So let's say at age 65, you've got Parts A and B, original Medicare, you go 10 years and you never enroll in a Medicare Advantage prescription drug or a Medigap plan with a prescription drug plan. Let's say you're 75 now, all of a sudden you're really interested in joining a Medicare Advantage plan with prescription drug coverage. You're looking at a pretty significant late enrollment penalty to do that. So for the 10 years of missed coverage, that's 120 months. You're looking at roughly $40 per month in penalties that stays with you as time goes on. So certainly not ideal.
Mm-hmm. What is the coverage gap or the Medicare Part D donut hole?
Yeah, so it refers to the period with which people who have Medicare Part D drug plans have to pay for a certain percentage of their drug costs. So during the coverage gap, there's a temporary limit on what the drug plan will cover for drugs. So once your total drug costs reach $5,030 for the plan year, you're in the coverage gap. That includes what you pay and what the plan pays. You'll have to pay 25% at that time of the cost of your generic drugs and 25% of the cost of your brand name drugs until you've reached this $8,000 maximum out of pocket for those prescription drugs. And again, that's not all your cost. It's what you're paying, and it's what the health plan is paying, and the prescription drug companies.
Okay, very good. How do I know if my drugs are covered under a new plan?
Yeah, great question. So each carrier and or plan has a different formulary. A formulary is the list of prescriptions that plan offers in network. So they're rated on a scale of tier 1 through tier 5, tier 5 being the most expensive typically. So you could look at that formulary or work with an agent like Gary to talk about, here are the drugs that I'm currently on, and is the plan that I'm looking at going to provide coverage for those drugs. Those formularies are available to you online and by the carrier, but also it can be complicated to do. So I recommend that agent, working with an agent to help you determine a plan that's going to make sure that you've got coverage for those things.
Now, Lauren, a question just popped in specific to what you were just saying about the tiers. Tier 5 meds, what is coverage on that?
So again, that's going to depend on the plan and the carrier. So you'd have to look at that. Typically, those are going to be more of your like your cancer drugs, your infusions, or excuse me, not infusions, because those are covered under Part B, but just your brand name drugs that are going to be the most expensive under that tier 5. So again, as we kind of look to try to avoid the donut hole where possible, I would always recommend looking for generic drugs in place of those more expensive brand name drugs.
Okay. What are the pros and cons to choosing a standalone Part D drug plan through original or traditional Medicare versus through a Medicare Advantage plan?
Great question. So if you choose to go the original Medicare route, and let's just say it's original Medicare with a standalone prescription drug plan, that standalone drug plan is going to have a premium associated, whereas a lot of the Medicare Advantage plans that are popular on the market today, they're typically $0 premiums and provide that prescription drug coverage in the plan. Mm-hmm. So it's a savings of a little bit of money on that premium each month.
Okay. Yeah. I heard that Medicare is negotiating with drug companies to get lower prices for some common drugs. When will I see those lower prices, and how can I find out if my prescriptions are a part of this negotiation?
Yeah, so you may have heard of the Inflation Reduction Act. In that piece of legislation that was passed, it's essentially working to lower the cost of drugs for especially our senior population. So the most recent impact was for coverage of insulins. So already in effect is for diabetic members who are on an insulin. They're going to have that insulin, a 1 month supply of that insulin capped at $35 for a 1 month supply. This was not the case before. They were paying, they were often going into the coverage gap with their insulin, and it was cost prohibitive for them. So the government is looking to find ways in which we can cut back on the costs that Medicare beneficiaries are paying for those more common drugs. So they're looking at the most expensive ones first. So again, your cancer drugs. My mom has multiple sclerosis, so she takes a drug for that. Those are going to be your more expensive drugs, and they're working to make those more affordable. So in 2024, there will be a cap on the annual out-of-pocket costs in Medicare Part D, and then in 25, that cap is going to drop even more, and then they're going to continue to index that cap going forward.
Yeah, and I'm going to
So-
give you a specific, very specific to this person situation. Perhaps you can help them with the donut hole. How do you avoid the donut hole? All the plans I reviewed for 2024 have me hitting the donut hole by August of 2024. In 2023, I hit the donut hole in September. My medicine went from a $30 copay to $269 a month, which I cannot afford.
Yeah, it's a very tough reality, I would say, for members who are on expensive drugs. So again, the first thing I would do is look to see, are there any generic alternatives that I haven't tried? And I would chat with your doctor about that to see if there's some ways you can cut costs with that. If you know that there's no less expensive drug available for your specific condition, the hope is that this Inflation Reduction Act, looking at more of the drugs that are very expensive and making it hard for seniors to access their drugs, that those will be the ones that are impacted. I would also recommend calling your plan to see if there's a way that they could help. There are some drugs or some drug companies that will allow members to have coupons and that kind of thing for drugs. But again, it's gonna vary significantly based on the type of drug. But step therapy, there are things that you should chat with your doctor about to see, can I lower my, am I able to lower the amount that I'm taking? Is there a generic alternative that might be more affordable for me and still achieve the same results? Those types of things would be important to consider.
Some specific ones, I'll just go down the list here. And it's not a full question, but it goes like this. What about covering integrative medicine?
Yeah, so I get this question a lot, and I'm a fan of having a variety of coverage options. I think a lot of members are looking for more of your, I don't know if this is what you're referring to, but like chiropractic or acupuncture. Those things are generally covered in a Medicare Advantage plan, but again, that's going to depend on the carrier and the plan. Medicare does not cover those things very extensively. So you would want to find a plan that would allow you to seek services like that as much as is needed. There are limitations that Medicare has in place for those types of things. But my hope would be that as time goes on and those types of treatments become more popular, that's something Medicare Advantage plans could do more to provide to members.
Okay, are there any Part D plans that cover hormone therapy?
I honestly don't know off the top of my head what hormone therapy. My thought is that it's going to vary by plan. I'd need a specific drug name to look it up. But again, whatever the drug name is, you'd want to check the formulary to see if that's something that's covered. If it's not covered, which I have a feeling it might not be, then it wouldn't be covered by original Medicare either.
Okay.
I don't know if Gary would have anything else to say about that, but.
Well, we can, when we come back together, perhaps if he has some thoughts on that.
Yeah.
What plan is best for insulin pump supplies and the Dexcom?
Yeah, great question. So again, that Inflation Reduction Act that I spoke about has kind of leveled the playing field. So all Medicare Advantage plans have the same coverage for, in terms of cost, more or less, you're going to be capped at that $35. So you're never going to pay more than $35 for a 1-month supply of insulin. Typically, like your continuous, not typically, it is, your continuous glucose monitors are covered under durable medical equipment. So we talked about that Part B. Durable medical equipment is covered under Part B. So you will pay 20% coinsurance for those continuous glucose monitors like the Freestyle Libre and the Dexcom.
All right. Should I enroll in Part D along with my A and B until my retirement health plan begins in April 2024?
Yeah, so you don't want to have, what you don't want to have happen is to be enrolled in parts A and B and not have any creditable drug coverage. If you're already on a group plan and you've enrolled in both Medicare parts A and B, you likely have creditable prescription drug coverage. If you do not have that, then I would either pick up a standalone Part D drug or look at a Medicare Advantage plan, because again, you're going to probably pay $0 in premium, have that prescription drug coverage. And even if you don't use the Medicare Advantage plan, though we hope you do, you've got that coverage for a $0 premium.
Okay.
But I would also recommend talking to an agent, because they'll be able to go through what are your needs, how can we best direct you based on, your budget, your lifestyle, things like that.
Okay, so Eric, if I could talk to Eric here, and can you hang on, Lauren, stay with us? I think we're going to do a big finale where we bring everyone back, because we have some more general questions that have come in, and perhaps we can, we can all field them, and then we'll let Eric do his magic.
Yeah, so that's exactly what we're going to do. We're going to make sure that you have the tools. So that resource page is going to be filled with all of this stuff. But right now, we're going to bring everybody back for kind of a Q&A to end today.
Very good. So I'll throw the first jump ball out there. It's a general, not drug plan related question. If I elect a Medicare Advantage plan and it doesn't work for me, are there penalties if I want to go back to regular Medicare and or elect a Medicare supplement?
There aren't penalties, but just to know that when you're 65 and you're going through the underwriting process for a Medicare supplement plan, you're likely going to have a lower premium than if you're 76 and getting a Medicare supplement plan. So I think it's just kind of choosing a track and where you want to stick. But the other good thing is, if you're on Medicare supplement and you're realizing that the monthly premiums are too much, there's no penalties for you to move to a Medicare Advantage plan.
Okay. If someone wants to leave a supplemental plan to get an Advantage plan, can they be denied because of pre-existing conditions? Is underwriting required in order to be approved?
There is no underwriting in Medicare Advantage. Guaranteed acceptance.
Yep.
I'm sorry, can you repeat that, because I didn't hear all the answer.
There is guaranteed acceptance in Medicare Advantage. There is no underwriting, so they cannot deny you coverage.
Okay. Question: should I enroll in Part D along with my A and B until my retirement health? Oh, we already got this one. This one's a repeat. So sorry, we won't do that. While we're waiting for any other questions that might come in, I would like to ask each of you, though, one piece of advice that you'd like people to walk away with when they're choosing a plan and deciding how to choose a plan. What one piece of advice would you give our attendees today?
I would suggest that you make sure, and I'm sure Lauren probably covered this, but I was typing in the chat. Make sure that if you're on prescription drugs, that they're covered under the formulary, what your cost share is going to be. That can be key, because the formularies are different based on the plans. Mm-hmm. So, you could be paying for a less expensive Part D plan, but paying more for your drugs than if you paid more for the prescription drug plan. So definitely something to consider.
Okay.
And I would say looking at your doctors as well to make sure your doctors are all in network. There's several different networks and several different plans. And I've had a client today that had, I think, 5 specialists and a primary doctor. So we do a search to make sure that each one and every one of them are covered.
Excellent. Margaret?
Yeah, I mean, I completely agree with what's been said already, but, don't get excited about some of the kind of tactics to kind of lure you in, and make sure that you do your homework. So we talked about Part B buyback as an example. Some plans 100% above board, great benefit, others maybe not. So just doing your homework. If I'm getting something, sometimes it sounds too good to be true. It may be for you particularly. So just making sure that your needs are being met and looking at the whole continuum and not just that one thing that's kind of catching your attention.
And Lauren?
Yeah, I would echo what everyone already said. I would also say, gosh, if it was my family, my loved one, I would direct them to an agent that I know and trust. I would ask around for my, friends to see who they are working with and if they would recommend them to a friend. I just think it's so helpful to know what your options are. And the other thing I would consider is, again, that local health plan, I think, makes a big difference. You can call in to customer service and have, I think, a much better experience in that. And I guess that's the other thing I would say is if you're confused about something, you get a piece of mail from a company, or you aren't sure, what that explanation of benefits is, or you're not sure how to use a benefit, call the company and ask, and just take note of that experience. In my mind, getting quality customer service is a big part of having a health plan. So that would be another thing I would consider.
Yeah, one thing I'd like to say just from doing this, and I felt this last year too, but it reminds me of, is like when I have a question about car insurance, I got a guy. I've been with the agency for over 20 years and I've got a guy. And instead of going online or try to confuse myself, I call my guy and I trust him. I have a trusted relationship. And it's the same. I have a financial advisor. It's the same way, because I'm not an expert, but I know somebody who's is and has my best interests at heart. And I think that came through loud and clear, that even if it's not you or your company, you really want the best for these people to get the best plan for themselves. And that the way that to provide some confidence and comfort is to find that trusted person and continue to evolve with those people as you age or your circumstances change. So this is last year, I told Eric after the event, this was one of the favorite things I'd done in a long time. I've enjoyed it just as much tonight. So thank you all. I appreciate it very much. And again, Eric, thank you too for hosting. I appreciate it.
Yes, and thank you to all of you. The information has been incredible, as it is year in and year out. And as I said right before the Q&A, we want to make sure that you have all of this information at the ready, because you've been given a bunch of amazing information. So that resource page that is currently in the chat, that will have all the in-depth information, and we'll also be sending you that email with the recording of today's event and the comprehensive Q&A from our experts early next week. Now, before we part ways, your feedback always matters to us. And we want to know if today's session was valuable for you, and more importantly, how we can improve it for the future. So take a moment to share your thoughts in the survey. The link is in the chat right now, and you'll also get that in your email as well. A heartfelt thanks once again to all of our sponsors, Priority Health, HAP, Blue Cross Blue Shield. Your support makes today possible. And of course, a virtual round of applause, if you could do that in the chat, that would be amazing, for all of our speakers who shared their time and expertise as well as their insights. And to you, thank you for joining us today for the Guide to Medicare and Golden Retirement event. We hope to see you at our next gathering. And until then, have a wonderful evening. We'll talk again soon.